Douglas Robinson, Podiatrist, Campbell, California. I'm going to show you how to wrap the foot 5 to 7 days after having a bunion correction if you're unable to go to the office for the first post-operative visit, or the doctor said you can do this via telemed. Make sure you report to the doctor if you've got a persistent headache, shortness of breath, chest pain, calf pain, or pain that seems to be way out of proportion at your foot. When you take the dressing off, you should notice that there is a little bit of swelling, but it shouldn't be bright red. And if you touch it after washing your hands, it shouldn't have a fever. It might be a little bit warm, but it shouldn't have a fever, and no purulent drainage, like no pus coming out. So this foot that we're going to wrap has not been operated on, but we're pretending like that is the incision. The supplies you will need for the post-op dressing change is gauze, polysporin or neosporin to go right across the incision. You'll need 2-inch Medi-Rip or Coban. You'll need 1-inch cloth tape and some scissors. So the purpose of this dressing change is to freshen things up. You're going to see some blood on the existing dressing. There should be no active bleeding going on now. So let's get to it. So you're going to put a bead of polysporin with the Q-tip. Again, wash your hands before you do this, right across the incision. Now you're going to pad this with some gauze, 2 or 3 layers here, 2 or 3 layers up here. And if you're one of Dr. Robinson's patients, on the incision is going to be a great product called a zip line. And that's what I put on the incision instead of using stitches, so you won't have to have any stitches removed. But it looks kind of like railroad tracks, but it's just an adherent on both sides with these little zip ties that keeps the incision coapted. So you'll take the Medi-Rip and you're going to wrap so that you can see the cleavage of the toes. And you're going to bring this up towards the arch. So you're going to wrap 3 or 4 times. How tight? It should be comfortably snug. And what's neat about this is it sticks to itself. There's no adhesives. Then you take a piece that's 6 to 8 inches long. You'll fold it in half. This now goes between the big toe and the second toe, and we're going to splint this toe so it's even straighter. So I want these to cross parallel to the arch. Pull the toe over a little bit, and this now is going to go parallel to the arch. So when you're done, you're going to see a little gap from the big toe. And this then should be parallel where they cross to the arch. By doing it this way, the toe's not going to be elevated. So if you pull this too much, the toe stays elevated. We don't want that. If you pull the bottom one too much, then the toe is plantar flex. We don't want that either. And then we want this to gently be secured with the Medi-Rip. Again, 3 or 4 wraps here, comfortably snug. And now to prevent this from sliding off the foot, we're going to be using 1-inch cloth tape. Half of it goes on the wrap, half of it goes on the skin. And that should stay just securely on the foot. I prefer my patients not to get their foot wet until the 2nd week post-op. So once you have this on, if it's comfortable, you don't have to change it. If it does get too tight, you can actually cut it right on the side here. Just make a 2-inch snip in the dressing. That will loosen it up without losing the sterility. So Douglas Robinson, Campbell, California, that's how we do our first post-operative change for bunion correction. Thank you.